wasn't big red flag stuff, but each time she was coming in, there was more of a disky involvement coming into the presentation. So I said to her, listen, we really do need to be a bit more consistent in our treatment going forward. Otherwise, this pattern that we develop is not looking great. Absolutely, she's on board. Cool. Treated her this time, probably needed a 5th or 6th treatment to get her going. I said to her, listen, I'm not happy. We should maybe start to look at either sending for an MRI or at least send you off to the neurosurgeon for another opinion. Absolutely, I haven't got time for that. I'm in busy practice. Off she went. 6 weeks later, she was back. I said to her, I don't like this. So at the time, I contacted a neurosurgeon I work quite closely with at Lexfield Clinic. And I said to him, listen, I'm sending this lady.
So you work closely with neurosurgeons?
Yeah, it's interrupted. No, absolutely. But I mean, there are those presentations that you either know are going to be borderline from a conservative therapy perspective, or you know from a conservative therapy perspective, this is actually a surgical case. So I contacted him and said, listen, I'm seeing this lady through. I think I need you to have a little look. She's an MRI. Have a little look. Let me know what you think. So further background to the story was that she'd obviously got married in the interim and they wanted kids. So every time they felt pregnant, she would get a certain way down the line and then she would miscarry and try everything. And gynae was obviously quite concerned because there'd been 3 or 4 incidents where she had miscarried and she just wasn't able to hold on to the embryo. It got to the point where the gynae actually said to her, listen, you're out. For the next year, I do not want you even trying. Your body needs a chance to recover. You've had 5 or 6 miscarriages now. This is not good. We need to give your system a chance to sit down and then we'll review. Maybe we need to do IVF. Maybe we need to look at other things, but you actually need to give your body half a chance. So you are not a full pregnant. So, I mean, there was an interesting kind of addition to the story of what was going on. Anyway, send her off to the neurosurgeon at Lexfield. And he checks her out, sends you straight away for an MR. I have a missed call from him at about 12:30. It was a Friday afternoon, and I was busy with a patient. So I go to try and phone her back. Doc, what's the story? He says, listen here, I have not seen this bowel this big since I can't remember way. He said, we need to decompress that very immediately. I'm operating on it this after me. I said, Doc, if you have to cause up the indications have been there for a while. Put her under, up went well, great. Pain disappeared straight after the op. She had about 6 weeks recovery. She came back to see me, said how things going. I've been told to come back and see you because part of the process of healing and doing the rehab. And she looked great. She was awesome. So I said to her, listen, we need to follow this rehab program. And I think you'll be good. I think going forward, you'll be great. She was nuts and true to form. And I think I saw her twice and she got too busy. Life got busy. Practice got busy. And probably didn't see her for I think it was 6 or 8 months. Anyway, she came in from lower part and I said, what's going on? She goes, no, I'm getting all the tight in my lower back and I'm pregnant. I'm like, well, I said, was that why? She said, well, I don't know, but I've been feeling good. So I think we should be fine. So just a bit, she was great. She was fun. The next time I saw her was after she gave birth to her first child. And she, as far as I know, she's now had 4 children. And basically dialing it back, the reason why she kept miscarrying was because of vectors, because there's some clinical disc, but as she was starting to go through pregnancy, her body was more than aware of the fact that the chances of her carrying it to term and she just kept dropping and having a miscarriage. The minute we sorted that discount, she's getting, oh, there's no body. And the regular chips a day, that's what we should be. And an amazing story. And I love this story.